It's been several months of vaccine distribution, and students at the University of Texas at Austin are steadily on their way towards a vaccinated campus.
It was really early in the morning. I had an 8:10 appointment, so I had to leave Waco at about 5 a.m. The line got extremely long, so I'm very lucky I was early, and I was in and out within probably 30 minutes.
By working at the clinic, I was considered a 1A since I was directly interacting with patients. It's definitely a privilege and an honor to receive that vaccine because it is part of history and it's a small step that I can take to protect not only myself, but also the community moving forward.
The university is providing vaccines to its students, faculty, and staff as more individuals become eligible to receive it.
President Biden has said that all adult Americans will have a vaccine available by the end of May. And at UT, we will do our part to deliver that vaccine to our campus community as quickly as we can, as determined by allocations and eligibility from the Department of State Health Services.
Whenever you get an appointment, you are sent a QR code, so it's easy check-in. As soon as the doors opened, I just went, got my QR scanned, then they scanned my ID, gave me my vaccination card, and then I went on to my nurse, and then it was just randomized just to whoever the nurse was open. I actually talked to my nurse for about 7 minutes-ish. It was just nice to have some human interaction.
They explained all the potential side effects. If I was at risk for complications from the vaccines, after we get the vaccine, we would go sit in an auditorium for observations for 15 minutes. The whole process was made really safe and everyone was there for you to support you.
If they want to receive the vaccine on campus, they need to go through a two-step process. First is a survey, which determines if they meet the criteria as defined by the Department of State Health Services. Once they meet eligibility, they'll receive an invitation to schedule an appointment. Of course, there are options to get vaccinated off campus through the city or other community resources. The most important thing, though, is that they get vaccinated as soon as they're eligible.
My biggest side effect has been fatigue. The day of my vaccine, I actually slept 16 hours that night. My arm hurt for a very long time. I think today was the first day it hasn't been hurting. It's been about 4 days since my vaccine, and I haven't had any side effects today.
After the second dose, I anticipated the side effects would be a little bit stronger, but that is completely okay based on how the immune system works. And so I experienced sore arm a few hours later. And during the night, I experienced chills and some muscle soreness throughout my shoulders. But by the next night, like 24 hours, I was feeling completely fine, no more side effects.
I was a bit skeptical because of how fast the vaccine was made. However, I reassured myself that technology has advanced, that millions have gotten it before me. I know people that got it. So once I knew some immediate family that had got the vaccine, I felt safe taking it.
It is always okay to be skeptical about something new. I believe that through individual conversations and addressing their concerns appropriately instead of shaming them for having those concerns, I think it is like a better, effective way to engage the conversations about trusting in science.
We definitely want individuals who've been vaccinated to continue to wear masks and social distance. We know that the vaccines are very effective at preventing severe disease or even disease at all for the vaccinated individual. What's a little more unclear at this point is whether it's possible for someone who's been vaccinated to continue to spread the virus to others. Staying vigilant for everyone, those who've been vaccinated and not vaccinated, is particularly important while we learn more about the vaccines and their effectiveness. It is not mandatory to receive the vaccine, though it is definitely highly encouraged. And the more people that can get the vaccine, the faster, the sooner we'll get to herd immunity and be able to hopefully move out of this pandemic and back to something closer to normal.